and it is my pleasure to introduce to you Tiffany Bomer. Tiffany is our account manager for the 1 to 50 marketplace with Coventry, and she's here today to go over the Coventry Small Group 2015 product training. So with that, I will turn it over to Tiffany. Thanks, Tiffany.
Thanks, Lynn. Okay, good afternoon. We'll go ahead and get started. Like Lynn said, I'm Tiffany Bomer from Coventry, and I'm here to talk to you about our 2015 products. We first like to start all of our presentations with our value wheel. This is just to remind everybody internally and externally what our values are, that we like to do the right thing for the right reason, that we are striving for excellence, we inspire each other to explore ideas, and that we are very caring and respectful of customers and our coworkers and our partners to ensure that everybody are working together to for the people that we serve, our members. Today we're going to cover our new 2015 product portfolio, our prescription drug changes, talk about some network enhancements, as well as touch on our Aetna specialty products. In 2015, we've added 4 new products to our portfolio. We've added 1 gold, we've added 2 silver, and 1 bronze. We have done this to try to give more choice and options to our customers. One thing for our 2015 product portfolio that we are really trying to do is simplify things so that it's much easier. And so with our individual deductible and max out-of-pocket, our family for these plans are just going to be double. So if the deductible is $1,000 for an individual, it's going to be $2,000 for a family, and the same for a max out-of-pocket. If it's $3,000 for an individual, it's going to be $6,000 for a family. Most of our non-HSA plans are going to have a 30/60 copay. So 30 for our primary care office visits and a 60 for our specialist office visits. There are a couple of our bronze plans that this it's a little bit higher, but for our gold and silver plans, this for the non-HSA plans, that office copays are going to be 30/60. In the past, we've had the emergency room copay, and then if you are admitted, then you would still have that copay charged. That has now, we are changing that it will be waived. So if you go to the emergency room and you are admitted, then that copay will be waived. All of our HSA plans are going to be aggregate, so you're going to need to, a family plan would need to meet the full family deductible before the benefits would kick in, as well as you would need to meet the full family max out-of-pocket for your plan, for you to no longer have to pay any more for that plan year. We have added, to simplify things, our out-of-network coinsurance is going to be a straight 50%. So every plan that we offer, last year we had varying coinsurance for out-of-network. It's going to be a straight 50% across the board, so that makes it easier for you to remember. We have added a new this year, we've added an out-of-network prior authorization penalty. And what that means is, in the past, if you have had an out-of-network service done that required prior authorization and the member did not get that prior authorization, then we would just deny the claim. Now we will go ahead and approve that claim and pay that claim as an out-of-network benefit. However, you will be charged a $400 penalty per occurrence. So we definitely want members to avoid that by making sure they get that prior authorization when visiting an out-of-network provider. This year we're not doing a tobacco rating up, so you will not have to obtain whether the members are using tobacco products, because it's going to be just the same rating across the board. This year we are doing 5 enrolled for a minimum for dual options. So if you have only 5 members, then you can provide 2 different options, plan options for you. And I will talk a little bit more about that when we get to the networks to talk about what type of networks can be provided with that dual option. So here's just a little bit more of a closer look at the Gold Freedom plans. The Freedom 1, 2, and 4 are going to be your traditional plans. The Gold Freedom 3 is going to be an HSA plan. So as I was talking before about the copays, the 1, 2, and 4 are going to have that 30/60 copays. The HSA plan is going to require you to meet your deductible, and then you pay the coinsurance. If you look at the lab and X-ray, where it says office visit and it's included in the office visit, that's something that we get a lot of questions about. If the lab or X-ray is done on site at your provider's office and it is analyzed on site as well, then it would be included in your copay, your office visit copay. However, if they send you across the street or even in some instances just down the hall, it may not be included. Like if it's in a hospital setting and you're in a clinic in the hospital, you would have to pay your deductible and then coinsurance. And then the chiropractic, that is going to be an office visit, the same as the primary care office visit copay. So that's going to follow that same throughout all the plans that we offer. Moving on to our Silver Security, we have, different deductibles and different max out-of-pockets that you can choose from. The biggest difference besides the deductibles and max out-of-pockets is going to be your coinsurance, because again, a lot of them have that same 30/60 copay unless they're an HSA eligible plan. So the coinsurance is going to really play a key role on what choices you want to make for those plans. Here are a couple other of our silver plans that we are providing. Again, the coinsurance is going to be the biggest difference. And then moving on to our bronze plans. Oh, and one thing that I forgot to mention too, as far as our product portfolio, the Gold 2 has been our top gold seller, and our Silver Security 2 and 3 have been also been some top sellers. So the Gold Freedom 2 here has been a top seller for the richer benefits. For the the Silver Security 2 and then 3 for the HSA has been our top sellers. And then moving on to the bronze, our HSA bronze have been more of a seller than the traditional bronze plans. So those are, again, just going to vary depending on your deductible that you're wanting and the coinsurance that your clients are wanting. The Bronze Essential 2 is going to have a primary care office copay of $50, and the specialist copay is going to be meet the deductible and then the coinsurance. Now on that Bronze Essential 2, I'd like to point out where it says deductible plus $350 plus 25%. That can be a little bit confusing. What that is you have to meet your deductible first, and then if you've already met your deductible, then you pay that $350 copay and then the 25% of the remaining bill. And again, that $350 would be waived if you were admitted, but you would still need to meet your deductible and then pay the 25%. And then again on that chiropractic, for the Bronze Essential 2, that's going to follow your primary care office visit copay. Here are a few other of the Bronze Essential plans. Again, the HSA ones have been selling more than the traditional for the Bronze Essential plans. Okay, moving on to our prescription changes for 2015. All of our RX copays are going to be the same. Last year, if you saw our product grids, it was a bit confusing because you'd have to match the Silver Security F with this plan, RX plan on the, down here, and it was just very confusing. So to simplify things, we have made all of our RX copays the same on all plans. There are a few. The medical deductible, however, is going to be a little bit different on the plans. The medical deductible does apply to all of the plans except for the Gold Freedom 1, 2, and 4. And then there are some plans where you meet the medical deductible for the tiers 2, 3 through 5. And I'll go into more detail on that in the next slide. We have added out-of-network RX benefits. Last year we did not have RX out-of-network benefits, and now it's the 50% coinsurance. We've also changed generics from having 2-tier generics of a $3 and a $10 to a $5 straight across the board for generics. Okay, now moving on to this chart where it shows a little bit more in detail where that Gold Freedom 1, 2, and 4, it shows that they do not have to meet the medical deductible. And if you see, look on Silver Securities 1, 2, 5, and 6, where there's not an X, that means that you don't have to meet your medical deductible for tiers, for the first tier, for the generic, but you do for the other tier levels. And then on the Gold Freedom 3, the Silver Security 3, 4, and the Bronze Essential plans, you do have to meet your medical deductible before your RX benefits kick in. Okay. Now we'll move forward on to network. So one thing that we're really wanting to promote this year is our high-performance networks. We do really encourage this. It's been more of a top seller with our smaller groups like our 3 to 4s, just because maybe a lot of the employees or all the employees on those plans are seeing all the same providers. So it's been a bigger selling point for them. Plus they get reduced premiums. It's 15 to 20% savings. So also, we encourage them to do this because of the long-term care and cost reduction that they will see, because seeing the same providers and the same network, they're not going to have to go from one network to another and do double testing. So this is a reason why we also promote this. And then again, just giving them, it's the same access to the same providers that they see, especially if they're already seeing those doctors, then they might as well take benefit from saving 15 to 20%. This is going to be our network map. We do have coverage in all 99 counties. This shows the high-performance networks are going to be in the colored shaded areas. So we have our patient preferred over in the yeah, that's right, the northwestern part of our state. The central state with the Polk and Warren, Jasper counties, those green areas are going to be, we have the Unity Point Health, and then in the Mercy Des Moines network, we do have Polk, Dallas, and Warren counties. And then up in the area with the Cedar Rapids area, in Cedar Falls, we have the Unity Point HPNs, and then the Quad Cities HPNs over towards the eastern part of our state. And if you were to pick a plan that is a Unity Point plan, you would have reciprocity. So if you are living in Clinton County and you went to a Des Moines hospital, you would have that same in-network benefit. And another thing that people do have question about is if there's a provider that's not in one of those HPN networks, let's say they don't offer that specialty, you would be granted permission to go to an out-of-network provider if that arise, that you needed to see somebody that it wasn't a specialist that was in the high-performance network.
Can you think of an example at all where that might be true?
No, I mean, I haven't seen anything exactly in our, I've talked with some people in like the Illinois, is it the Missouri area where they have a needle or a neonatal that isn't provided in the network, so they were granted access to that neonatal care that specialized in it. Yeah. So we have that same sort of agreement too, and of course you would be referred to another, like probably like if you were in a Mercy and a Unity Point had that, then you'd be referred to that before you'd be referred to like say a Mayo. Okay, and then we have our Nebraska High Performance Network map, and this is going to have the Allegiant, which is also the CHI, and the Methodist Health Partners, MIPA, Alliance Healthcare, and that's going to be in the Douglas, Sarpy counties, and then that St. Elizabeth is going to be in the Lancaster counties. All the other counties have our point of service network except for the Knox and Thurston counties. Those do not have network. These are the new 2015 high performance networks that we've added. So we've had the Unity Point and like the CHI, but we've added in the Mercy Des Moines, the Accountable Care Alliance, and the St. Elizabeth Regional Medical Center. And here are just a few of the highlighted clinics that and hospitals that are in network. This is a big thing that I just want to make sure that everybody understands, that we have this Coventry National Network that is wrapping around our point of service regional network. So this is very comparable to a PPO plan that you would maybe be comparing with your well-marked PPO plans, where you're going to have access to both our regional network as well as our Coventry National Network, where we have providers that are like our PPO providers. They participate in our Coventry National, where they may not participate in our point of service network. An example that I want to give to you is the Dubuque area. We've had a lot of questions and confusion surrounding our network there, because if you do go to our website and you only check the point of service network, you're not going to see very many providers, but you do on these plans have access to our Coventry National Network, so you would want to check that provider search as well, and then you would see that all of that there are a good number of providers that are in network that they have access to. And I do want to show you really quick at this time how you can go and do that search. Okay, so if you go to the Coventry, you just go to CHC Iowa, and at the top there's the find a doctor that you would want to click on that, and then scroll down the page and enter into the provider search, this link right here, and then that will take you over to this page where if you are looking on the point of service national, or I'm sorry, the point of service local regional network, that's where you would click on here and look for doctors. But again, like if you are not finding the doctors that you're wanting to see if they're in network, you would want to also double check the Coventry National Network.
You gave an example of Fairfield, Iowa, as an example of there's very few, if any, POS doctors in Fairfield. So when you check there first and go, whoa, no doctors are in network, then go down to Coventry National Network and you'll see providers that have signed on to the Coventry National. So when you're working with Coventry, I'm not talking about these high performance networks, this is the POS.
Right.
You also get with it the wraparound national network with the POS. So in essence, you are back up to that. You've got a lot of physicians then available.
Yes, exactly. And again, the Dubuque area is another prime example that because you might look there and there might be only one or two providers that are showing up, well, that's not a true picture of what access they have. So we would definitely encourage you to check the Coventry National Network as well.
I think you said medical associates.
Yeah, medical associates is not currently on our point of service network, but they are on the national network. So if you have a Dubuque, a group that's in Dubuque, then they could still sign on and they would have access to those providers through the Coventry National Network. Okay? Okay, so this just kind of shows a highlight of some of those networks, those key health systems that are in network. And of course, we want to make sure that you are reminded that the Mayo clinics are also in our network, and they are in both our point of service network and our Coventry National Network, but we do still get a lot of questions about that. So we want to make sure that you know that they are in network. So going to the quoting process, some of the things that are needed for doing a small group quote, they need to provide the company name and address, dependent level census, including home zip codes. If you wanted to run a quote without the home zip codes, we certainly can do that and use the company's zip code. However, I just want to throw out there that, you know, the rates could slightly change based on the home zip codes. And then please send your quote request to your following KHI representatives. Give you a minute to take any of those down. I'm sure you probably already have them, but just in case.
And just clarify again, because I'm getting some funny looks in the room about, I think we've been just using the zip code of the business of where it's domiciled. And so I'm just seeing some funny looks around the room about concluding home zip codes. Because if somebody's in a different region.
Yeah, if they're, yeah, I mean, it doesn't happen very often, but if for some reason they are located outside of that area, so the demographic would change a little bit, then it could make a change to their rate.
So they're not, I guess is what we're finding out. It is based off of the zip code of where the employee lives.
Correct.
And that is different than another carrier that we use. Right?
Yeah, because it asks for the zip code on each person.
For Coventry.
Yes, otherwise you cannot continue.
Okay, so that's a good, that's good to know, because I think it is with the other big carrier that we use. It's just where's the company domiciled, they base everything off of that. And so we're seeing a little bit of a difference here. And hopefully it's not a big deal, but it can be, again, as we said, if there's an employee that's located in another, well, certainly around Iowa, but even, I guess, outside of Iowa, if they had employees outside of Iowa.
Right.
Okay.
Right. And again, we haven't seen a significant difference in the rate change, but it might be just, you know, it might be $5 difference, but it is something that you definitely want to make sure. And another thing, too, is if you've entered in ages instead of birth dates, that can sometimes have an impact, too, on the rate. So it's best to get the date of birth up front, just that way we can have the best, you know, the most accurate numbers for you.
Well, and even if you didn't have all the zip codes, because sometimes we are trying to get a quote, aren't we? And it's like they don't want to provide all the different zip codes, so we'll use it off that one. Maybe our teachable point is just make sure they know it's close, but once we finalize it with the zip codes and or sometimes the whole date of birth thing, we've had that too, haven't we? They just give us ages, and so then somebody has a birthday or they were just off, and by the time we implement it, rates have changed. So as long as I guess we're saying the caveat here, could change slightly, but this is going to give them a really good idea.
Yeah, exactly, exactly. We can certainly provide you with a quote using the zip code of the business and again, just using ages, but for the most accurate quote, we would just do it that way. And then as far as the enrollment process goes, we would need the employer application, enrollment forms, and waivers. We have added a new really exciting tool, which is our enrollment spreadsheet that it's basically the census, but you would have to make sure that the date of birth is correct and that it also includes the home address, the Social Security numbers, and then dates of hire for the employee, but that's essentially all we would need, so you wouldn't have to obtain employer apps for every single employee, which is great, helps you guys get things done a lot quicker.
And you do need the waivers then, because we have, that's Okay, so Coventry needs the waivers.
We do, if you do the enrollment forms, if you do the spreadsheet, there is a place where you can put that they're waiving coverage because, and so they wouldn't have to fill out a waiver. And then also we would need the current carrier bill, wage and tax, current wage and tax, billing service agreement, 90-day acknowledgement, initial sold rates, the SBC agreement, and then if you were selling a dual option, then we would need the employee election.
And we walk our agents through all this information, so I don't want you guys on the phone to get overwhelmed. This is what that's why we're here, and we'll get you through all this information that you need.
Okay. And then billing, this is something that we really want to make sure that we're getting out to everybody because this is a pretty new change, effective 2/1 of this year. This is going to be for new business as well as renewals, that composite billing will now be given to groups of 10 or more. So they will still see, when we quote them, they'll still see that age-banded rate. The monthly premium is going to be the same. It's just going to average it out for them. So this is just a way to help simplify the employees, or I'm sorry, the employer's tracking of contribution. So if they wanted to do it like a 50% straight across, where, you know, it was a balanced out, they don't have to think, okay, what's 50% of this age and what's 50% of that age. It would just be one simple, this is the amount that we pay. That would be something that would simplify that process for them, and that is how they will be billed. However, they can bookkeep however they want to, so if they want to do the age-banded rates, then they could do that, but they will be billed the composite rate. And again, I just want to make sure that you know that the monthly premium would be the same as the age-banded rates that are on the quote. So the quote actually shows both the age-banded and the composite rates.
So let's do a scenario where somebody adds to the group then, and it's a 52-year-old. So they're going to use the member level rate to add that to the premium that's owed. Are they going to go back then and change the composite rate for everybody?
From my understanding is that no, it would still be that composite rate.
Yes, okay. Okay, I know we're kind of looking, at least I'm doing the funny face again just because, you know, when you offer that composite rate and it's based on a certain demographic of people, and if you, let's say you lose one and gain one, and their ages are different, that could throw those, like you said, the total number that the total is what it is that you're going to bill. But yeah, how those could change.
Yep.
The numbers could change, and you'd almost think that you'd want to lock them in for the year, so to speak, in terms of the composite. But
right, and that is my understanding. That is how it would be. I will get some clarification just to double check that that's correct. And then groups with 9 or less, they will continue to get those age-banded rates. Another thing that we've had some questions about, our effective January 1st, we've changed our billing time. So bills are going out instead of the 10th of the month, they're going out the 15th. So you may have some groups that are asking why their bills are coming in late. There was a communication piece that was included on that first January bill, but you know, oftentimes that can be overlooked. So if you get any questions about late billing, that is why, and that will be the time frame that it will come moving forward.
So it's the 15th of the month for that current month's bill.
It's the 15th of the month for the next month.
Okay.
Yes.
All right.
Yep. Mm-hmm. Okay, and just wanted to bring up some just high-level information about the stable funding. We're not going to go into too much detail here, and plan to do another webinar that we will give you much more detail, but just so that you know that this is an option for you, we do have the self-funding for groups of 25 plus eligible, 20 enrolled. So we want to make sure that there are 20 enrolled to do the stable funding. The groups that we're really looking to offer this benefit to are those that would maybe benefit from having a medical underwritten rate as opposed to the ACA rate. So if you have a group that, you know, they before were a really healthy group, and when they went to the ACA, there's, that pooling change, so they have increased rates significantly. This might be a good alternative for them to take a look at. We do have some stop-loss coverage to help against catastrophic risk. So we have the specific at $30,000, and then we have the aggregate at 110%. So you may want to know, well, why would I want to do this, or why would a group want to do this? And here's why. They are going to get a monthly bill that's going to be very similar. It's going to look and feel just like a fully insured plan. They're going to have a set monthly payment that's going to go towards their claim amount. Then if they go past that, if their claims go beyond that claim amount, then they have that stop-loss coverage that's going to prevent them from any of those high claims. And then and then they also have access to the same network, the same health benefits that they would on a traditional fully insured plan. But if their claims are lower than anticipated, then they're going to get money back. So this is not, this isn't going to be an answer to every group, but if you have some groups that you think might potentially save money, or that you think might benefit from this, then we would definitely encourage you to try to quote it. And we have the option of doing a member level census with the home zip codes. We would need a current carrier bill, and if and their renewal rates, if they were a 51 to 99, where they had underwritten rates previously. The other option would be doing the health apps. And then we can also do an illustrative quote where we would just use the zip codes and their current benefits. And then if everything looks good, then we could lock in those rates. We do also, so that would be for the 25 plus enrolled. For groups of 20 to 24 enrolled, we cannot do the member level census quoting. We would have to do the traditional health application. So like I said, more to come on that. We hope to have another presentation where we can get into much more detail, but just so you're aware, those are another option that you can provide to your clients. And send it into your KHI representative. Some materials that we have available, and let us know if you need these. We can get them to you. We have our sales book that just gives an overview of our plans, some of the benefits of choosing Coventry. We have our maps, our network maps, our high-performance network flyers for the different high-performance networks. We also have the summaries of benefits available to you. And just wanted to bring your attention to just the ID cards. They've changed just a little bit in that they have the network a lot more prominent on the cards, so that there's no confusion for the providers as well as the members to know what their network is. And again, Aetna Specialty Products, we're just going to really high-level touch on, but want you to make sure that you know that they're available and that hopefully we can have a training on them. We do provide dental, vision, life, and disability, and this goes down to our 2 to 9 also. So if you have a group that of 2 that would like vision coverage, we do offer that. And we also offer it for dental, life, and disability. But I don't believe any other carrier is offering vision down to 2. So I think that's just something that I wanted to make sure that you're aware of.
And that's IMED, it looks like, right?
It is actually, it's Aetna Vision, but we do have discounts through IMED and through our IMED provider network. So if you go to an IMED provider that's linked into the Aetna, there's some like 40% off of a second pair of eyeglasses, or 40% off of above your allowed amount for contacts. So there's some pretty good discounts with that IMED. Okay. Also, just want to remind you of our online account management system. So this allows employers to be able to add and terminate employees' coverage, they can download their member rosters, make payments, view balances, request or print ID cards, access to their health care utilization reports. So lots of, makes it a lot easier when they're able to just go in and add a new employee or terminate a coverage. So that's something that we definitely encourage our groups to get enrolled in. And we do provide a demo, so if you have a group that is interested in getting enrolled, we do have a demo link that kind of walks them through how they can get signed up and how to navigate their way through the system. My Online Services. This is a great tool for members to be able to track their health information. They can view their prescription claims, their medical claims, see what's, prior authorization, if it's pending. Lots of great things that they can access on the online. And of course, we, if they're on the go, they can do it through our Coventry web or mobile app. So lots of great stuff there.
Question back on that prior slide.
Yeah.
Is there a way for agents, and maybe you guys know this, and so this is a dumb question, but for agents to get access to be able to act on behalf of the employer?
From my understanding, I believe they would just have to get the login information, so we don't have like an agent portal that connects to it. But if they were to obtain their login information, then they certainly could get on there and do that.
Okay.
And again, this has there's a guided tour on our website, so they can see how everything works and where to find everything, help them navigate through the system. And then they have access from there. They have access to our our online coaching, and this is great for members that are wanting to, focus on controlling their cholesterol, losing weight, quit smoking, control blood pressure. Lots of great tools here that they can get involved with and try to help get healthier. And now I will turn it over to any questions that we might have.
Okay, well, let's start. We'll turn it over to the phone folks too, but do we have any questions in the room? I forgot to tell you guys on the phone that we have Nakia and Doreen and Sarah and Tricia that are here with Tiffany and I in the room here in Fort Dodge. You guys have any questions that you can think of right away? Okay, I tried to ask a few of them. All right, well, I'm going to take over on the computer real quick, so I'll just, slide over here and see if you guys have any questions out in the telephone on the web. You can certainly raise your hand or type in a question. You should have the ability to do that. Okay, good. Somebody said, thanks, Lynn. I had the same question about agent access, so that's good. Okay, Mark, I see you've got your hand raised. I'm going to try to unmute you and see if you can talk to us. Hey, Mark.
Okay, hi, Lynn. Thanks for taking my call. A couple questions. Is the network that we're showing here for the individual market the same as the group market? And also, it looks like most of the plans show the labs and x-rays as an office copay. Is that correct?
I'm going to let Tiffany answer that one.
Yeah, so pretty much the Coventry One and the small group network is the same. The only difference is when you get over to the Nebraska area, I think there might be a few differences in the high performance networks, and I'm not quite familiar enough to really speak to it because I don't deal a lot with the individual, but as far as Iowa goes, they are the same.
So the point of service and the wraparound, if we're looking at that, that would be the same.
Correct.
Excellent.
Yep.
And then what was your other question, Mark?
Oh, am I unmuted? Can you hear me? Okay.
Yep.
My other question was on, it looked like most plans show lab work and x-rays done in the office as treated as an office copay. Would that be correct?
Yes, that is if the lab or x-ray is done at the same facility that the office visit is being conducted. So if it's, you know, the testing and the analyzing is all done in-house, then that would be included in the office visit. If you're sent to another facility, which could even include, like if you're in a clinic that's attached to a hospital and you get sent over to the hospital, then that would be deductible and co-insurance.
Okay. One other quick question, if I could, please, is Coventry involved with SHOP, or are any expectations of doing that in the future?
We currently are not on SHOP, but we haven't. I haven't heard anything on if we plan to participate next year or not, so I can't answer that at this time.
Thank you.
Okay, thanks, Mark. Let me just make a comment, too, that remember, too, there's a special, I'll call it special dispensation for any of those co-opportunity shop groups to get their tax credit for the rest of just 2015, whether they went to whoever. As long as they had already applied for it and were trying to get it with co-opportunity, they can still get it through the remainder of this year. And if you have questions on that, you can just give us a holler. But I pulled up the regs and found it in the law, so that did get granted to us Iowans in certain counties. I see another couple questions here, so let me let's see. I'll go with Brenda here, saying, can you provide more detail on how the 4-tier rate structure is calculated? So I'm guessing Brenda's talking about the composite rating, but also doing that employee, employee spouse, employee children, and family.
Yep, so it is a 4-tier, but as far as how it's structured or calculated, they do it based on averages. So they take the average calculation for all the group, and then they average it out to calculate those numbers. I don't know if I'm answering your question exactly, but that's how I understand it to work.
And I think, and chime in here in the room, but I think we had another agent with a case with Coventry, and they were 2-way versus 4-way, or 4-way versus the group was used to 2-way, and so the net is the same, right? In other words, the total premium, assuming you've got the same people you're talking about, would be the same whether you do 2-way or 4-way rates, and you'll offer them.
I'm not familiar that we're going to offer 2-way rates.
Okay.
From my understanding, we're only doing the 4-tier.
Okay. Okay, good to know. Isn't it funny, because the opposite used to be true, right? We couldn't get 4-tier rates for small groups, and now we can get them for small groups, and we maybe don't go back to the 2-way. Anyway, there's another question here. Let's see, Mark, and I think I got most of yours. We got the answer. The group network is same as the individual, and use the POS and the RAP. And another question here about Dean asks, so all group quotes have to go through KHI, correct? And that is correct. Today, Coventry does not offer a tool that agents can go to direct to do their own quotes. We are so fortunate in that we used to send all of our information to Coventry too, and they would do the quotes and get it back to us. But we asked for I'll say a special login, if you will, and they gave it to us. And so we now at KHI have the ability to act a little bit like Coventry in the sense that we can do our own quotes, and we don't have to send them to somebody at Coventry and wait for them to get back to us. So when you send us a census and we're trying to help you, we can get that for you. So yes, thank you for that question, Dean. Send them directly to us. Let's see. Did I miss it up at the top? Let me just go back here. Here we go. And see, Allison got a question here. Did Tiffany say all generics had a $5 copay? And yes, I can put that RX slide back up again. So yes, that's true, right?
Yes, that's correct.
All copays are $5. And
generic.
Or generics, rather, sorry. Generic copays, yeah. So let me move that for a second and see if I found it. We're talking about, here we go. There it is, right? Mm-hmm. So, yep, you can see that for all the plans. Yep, $5.
Is there a deductible first? Few of them?
Some of them are deductible first. That's correct. And, of course, on the HSA plans, but there's even some where you have to meet the deductible as well. Yep. Okay. So that was, hopefully I got Allison's question answered. And then, so that was, let me scoot down here and just make sure I got everybody. Keep typing them if you guys are thinking of them. Keep typing your questions. This is great. And then question also, Allison, so is there still non-preferred generic tier 3?
No, they're all.
So there's just a generic. You don't have a preferred or a non-preferred
Correct.
generic. It's just generic for $5.
Yep.
And then after that, it will go up to your brand.
Yes,
You
correct.
still have the preferred and non-preferred brands
Yes.
probably, and then specialty.
Yes,
Okay.
correct.
Wonderful. Okay, and then Kathy, it looks like, let's see, Kathy, you had the question, yep, about the agent access. And then these slides will be posted on KHI's website, absolutely. Thank you, Tiffany emailed them to me, so we'll be getting those posted on our website. If not today, hopefully by tomorrow. And let's see, and then Mark's asking here, what's the difference between open access / PPO versus Coventry One POS? Well, I think I've heard this. Oh, go ahead if you have, because I've heard that question and I've heard the answer, but go ahead.
Well, the PPO is going to be different than the point of service because, well, I guess I'm not sure about the Coventry One point of service. I'm guessing it's the same as the group point of service, but the PPO is going to be different in that there are a few providers that are PPO only that aren't in the Coventry National Network. So you maybe wouldn't have access to a couple of them, but for the most part, they're all in our Coventry National Network. So the point of service is more of our regional and providers that aren't participating in there are some that are, I'm boshing it all up. So there's the Coventry Point of Service Network that's going to have primarily our regional providers, and then we have the PPO that has the majority of our Coventry National Network and then maybe a couple extra, and then our Coventry National Network that has access to nationwide coverage. So the point is, if you're comparing the PPO plan with the point of service, you're going to have quite a few more PPO providers, but when you're comparing it against both the point of service and the Coventry National Network, you're going to have just as much, if not maybe more.
So I think maybe I could just comment because I heard it, and no, that's good. I heard it answered, I think it was James West who actually said, you know what, we have a PPO network, but we have built our POS network to such a degree that it's almost pointless to have the PPO network because our POS network has everybody in it that we want. And so when you combine that with your wraparound national network, we've got it all covered.
Right.
So I know it's semantics because we're used to some of the other carriers saying PPO and that's the best. And really what we're saying here is what Coventry's built is a phenomenal POS network with that national wraparound that makes it as good as, if not better than, a traditional PPO network. So some of it's just kind of splitting hairs on the semantics. But let me move on to another question here. And yes, we will post that on the KHI website. And we've got this recording as well, so we'll have the recording up there in addition. So let's just see if there's any other questions. I'm going to scroll down through and see if anybody else has raised their hand. If you have microphone access, because you might be using your telephone, we can certainly take a live call. And while we're waiting for any other questions, I wanted to make sure that anybody that was on the call this morning, again, I just want to apologize for the technical problems we had. We did get that rescheduled for next Monday at 1 o'clock from 1 to 2 o'clock. You'll be getting an invite to that if you can join us. But again, apologize for all the problems that we had this morning. As you can tell, we've got those worked out for this afternoon's presentation. So let's see if there's any other questions. Here's a question, Allison. On the bronze HSA number 6, it's a 100% coinsurance plan, but the OPM doesn't match the deductible. So let's go over to that one. So a bronze HSA, let me see if I can get back here. So there's the silver and silver. Okay, so go to the next one here maybe. Okay, so let's go to the bronze HSA number 6. So we're seeing.
So the question is probably how do you get to that max out-of-pocket?
Great question.
So what that would be is your co-pays for your RX benefits. That's what you wouldn't pay anything more on your office visits or any of your other medical services. It would be just on your prescription benefits that you would continue to pay the co-pays until you hit that max out-of-pocket amount.
Yep, great question. And I had to dig on that one because I had that one with another agent that I was talking to. So you had to dig on that one to find it. But yep, it's the RX copays. That'll take you up to that final out-of-pocket max. Great. And then I'll just peek again at those, I think the copays for the drugs, which were right here. And as you can tell, getting up into either a $75 or a $45 or even some of your percentages there on the preferred specialty or non-preferred, that can add up. So that extra $450 that'll cap your medical or your pharmacy spend. Yep. Okay. Great. Okay. See if we've got any other questions. I think I got you guys all answered. I'll double check here again if you have any other questions. Any other questions in the room? Comments? Nope, we're just really excited to be able to offer this training both on the group and then on the individual side as well for Coventry and soon to be Aetna. Maybe you can just make a little comment on the final kind of transitioning of Aetna. And I know Coventry is an Aetna company,
right? But
the branding, maybe you can comment on that.
Yep, we are planning on transitioning onto the Aetna platform. It's not completely defined yet, but it's looking like it's going to be July of 2016 for small group. And then I don't believe that individual will be until 2017, but it will be also for large group, it will be probably July of 2015. So we're still kind of working out. A lot of it is kind of boiling down to our network and our provider contracts and just getting everything firmed up. So that's the tentative date. It's not a firm July of 2016, but that's just kind of where we're talking right now.
Very good. And then let's also talk about commissions, because I think we can't have a conversation like this without talking about commissions. And you guys know that we've been in conversations probably for the last at least 4 months with Coventry about becoming a general agency for Coventry, about KHI becoming a general agency. It's especially critical on the individual side because the commissions are, well, I'll say this, it actually is completely across the product line because Coventry does the billing services agreement on all the group business, and on the individual, I mean, if we don't have anything built in, which, you know, then they're paying right now, as you know, they're $20. I'll just say the single, on an individual policy, it's $20. We'll get onto the commissions when we do the individual presentation next Monday. But in talking about small group, it's the billing services agreement, and they're kind of like, hey, build in whatever you want with the max, right? And the max today is?
$37.
Okay, and how high does that go? Up to what size? Is that as high as you go? I mean, for any size group?
You know, that's a great question. I know it's for 2 to 50 for sure, but yep. I don't know if 51 plus if that's the same.
Okay. I don't know if you guys have heard of, I mean, is there a cap also on the 51 plus? Okay, so Nakia's saying we've got it built in higher than that on the 51 plus. So 2 to 50, the standard, or the maximum, I guess, I'll say standard or maximum is 37. Well, I just want to be really clear. What's delayed the conversation going to the next level about becoming a general agency for KHI is really around the Aetna Coventry transition, if you will. Aetna has different rules around how they look at GAs, and so I'm trying to, as I continue to meet with leadership at Coventry, to determine what do we have to do to become a general agency, and what I call it is earn an override, so that we can pass through 100% of the agent commission. So I'll just tell you today, on a small group case, if you're going to charge the maximum, which is the $37 per member per month, that you're going to do an 80-20 split with KHI on that. So we're completely transparent about it. We want to tell you about that so you can do the math and see how much that you can earn in writing a Coventry case, and that's important. I mean, it's not. We know it's not the first thing we should all think about, but it's something that is important. So in doing that, you can do the math. So it's $29 and some change per member per month that you would earn on a Coventry small group case, and then just multiply that times the number of folks on your case. So the other 20%, it's $7 and some change is what goes to KHI, and that's our 80-20 split, and we're really upfront about that, and there's no other way that we're making money with Coventry other than building in the override with you together. So we work very closely with the agents. So we trust that our support and our help for you, helping you with the quoting and with all of the things that we can do for you is worth 20%. So just to get that out on the table, all right? So I know a lot of people, some haven't written a lot of group yet or written Coventry, and they're just used to writing with other carriers. So see if there's any more questions around anything that we've talked about today or anything I just mentioned. I know some of you are agents within an agency, and so you get a different pay structure. So we just are very transparent in how we do things, and we have to be because of the billing services agreement. And remember, Coventry has said we're going to pull that outside of the transaction because then it's not part of the minimum loss ratio. And there's some exciting things. I hope you guys can join me for our healthcare reform conference call. Remember, it's monthly, always the second Friday of the month from 9 to 10 in the morning. I'll be talking to you about my trip to Washington last week and all the things that are pending with the legislation and some things that we see that might be making some movement this year. MLR made me think of that, so no minimum loss ratio. Okay, and I'm not seeing any other questions. And let me do one more quick look through here to see. Oh, and I guess Kathy's point is, can we see the individual slides ahead of time so we can take notes next Monday? You know what? The slides will be posted. I have them, so the slides will be posted. I'll commit by tomorrow as well, and so you'll have them at least for sure before next Monday. So you bet, Kath. Oh, thank you. And there's Tanya. Does small group have an open enrollment period? No. Nope. Nope. Move anytime, right?
We'll take them anytime.
There you go. Well, we're excited about how I think your rates are more competitive now. We've been, as we know, it's nice to have the product, and we got to have a good network, but we got to have good rates. And I think what we were seeing initially for some of the rates, they weren't as competitive. But I wonder if you guys didn't do a refiling or something happened, or when do you expect? I think you were seeing, right, that the rates are starting to get more competitive. Second quarter.
We haven't really changed our rates much. I think that actually others are trending up a little bit, maybe. But we have, since the first quarter, our rates for our silver security and our bronze plans have been a little bit more competitive. And it, of course, also depends on the area too, where you're quoting. So.
Okay. Well, I've got almost 2:30, and I'm looking to see if there's any other questions. I just want to thank all of our agents for joining us on the call today, and feel free to get a hold of any one of us here at KHI to help you through the process. But good luck, happy selling, and we'll be talking to you real soon. We've got a lot of training coming up over the next several months. So thanks a lot. Have a great day. Talk to you later.